Many people in the UK have had a new illness called coronavirus. Some people who had coronavirus stayed at home to get better, sometimes getting help from a family member or carer. Some people had to go to hospital because they needed extra help to get better from coronavirus. Being in hospital with coronavirus may have been scary. Some people may think about their time in hospital even after they have left hospital and gone back home. Thinking about these memories might make them feel upset, anxious or scared. Having these feelings and finding them difficult to manage is called trauma. You can find more information about this in the video How to Manage Difficult Feelings After Having Coronavirus. After having coronavirus, you might still experience feeling tired even once you return home. Doctors and nurses call feeling very tired fatigue. It might mean that you can't do all of the things you used to do without feeling tired, or that it takes longer to do things at home. This might make you feel frustrated, annoyed and upset. After having coronavirus, people may have trouble sleeping. It can take some time to get back to your normal sleeping pattern. Using relaxation techniques might help you to relax and sleep better. We have some videos on how to relax on our YouTube channel to help with this. Someone who has had coronavirus may feel out of breath. This is normal. Exercising your lungs may help. You can do this by taking some long, slow, deep breaths or blowing through a straw into a glass of water. You may also feel weak, as you might not want to eat as much as you did before you became unwell. This is because you might have had changes to your ability to taste and smell foods. It is important when you are recovering from coronavirus to try and eat healthy food and keep drinking, even if you don't want to. This is because it will help you to recover and feel better. It might be a good idea to try food that taste or feel different to see if that helps. For example, trying sweet or spicy food, smooth or rough textures, or hot or cold food. Some people may find it harder to walk or do activities at home, such as washing or getting dressed. It is important to remember that it will take a while for you to get back to doing the things you used to do. For example, going out on a walk, or going food shopping, or helping to do the washing at home. Try doing things in small steps rather than all at once. For example, having a short walk and then having a rest. An approach called pacing might help with this. For example, when climbing up some stairs, climb 5 steps and then rest for 30 seconds. Do this until you reach the top of the stairs. This way, you may not need to rest for as long at the top or feel so tired the next day. If you climb all of the stairs at once, you might have to rest for 10 minutes at the top of the stairs. You might then feel tired and achy the next day. You can talk to your carer for more help with this. After having coronavirus, you may find it hard remembering things, or find it harder to solve problems, complete puzzles, or make decisions compared to what you used to be able to do. You may also feel frightened about getting unwell again. You may worry about your body and what you are feeling. You may feel more anxious or worried than you do usually. You might worry about the feelings that you have in your body when you are anxious. For example, your heart beating faster, feeling hot, or having difficulty breathing. Talk to your carers if you are worried. There are also videos on our YouTube channel for people with learning disabilities to help with feeling anxious. These include techniques like visualization or mindfulness, which can help with feeling calmer. After having coronavirus, you can also feel depressed, which can mean feeling upset, sad, down, or tearful as you think about everything that has happened to you. You might find it helpful to speak to people like friends, family, or carers about how you are feeling. It will take time for someone to recover from coronavirus, so it is important to go at your own pace. You might feel better on one day and then worse the next, but better the day after that. It is okay to ask for extra help if it is needed. Speak to your carers if you would like more information about getting better after having coronavirus.